On American healthcare. The time is now for healthcare reform. If you like our content, please do like, please do share, please do subscribe, and feel free to comment. 80% of Americans feel the system is broken, and 100% of those may be right. One of the most significant factors in this discontent is the cost of healthcare, which has become largely unaffordable for many. The last significant action to change our healthcare system was in 2010 with the passage of the Affordable Care Act. The Affordable Care Act was passed by a margin of 219 for and 212 against in the House of Representatives, and a margin of 60 to 39 in the Senate. That is not even close to unanimous. It is split just about down the middle. And as a result, since its passage, it has been the target of much criticism and disdain. It was not a perfect system, but it was thrust upon us. It was an effort, and I guess we'll have to call it a failed effort. We now have the opportunity to tell our government what it is that we want. But what we need to do is do that before it becomes law, so that perhaps the voting numbers will be more representative of a unanimous sentiment if the population contributes and directs Congress on reform. All 435 voting seats in the U.S. House of Representatives are up for election on Tuesday, November 3rd, 2026, and approximately 33 of Senate seats are also up for re-election. So the time is now for healthcare reform. There has been a long-fought battle for healthcare. Corporate influence versus the people. Big corporations contribute deep political money to politicians. And by doing so, gain heavy influence on legislation. The people do have the power. The people do have the power to elect officials that will govern in the interests of the people. We have to do that at the ballot box. We have to be a force that demands our government govern for the people and not chasing political money. We should learn our lesson from the past, and now is the time that we can correct that error. Folks, illness and injury are absolutely blind to political party. Any Republican, any Democrat can end up in a hospital bed, can end up taking medications, can end up needing therapy, can end up needing surgery. This is not a partisan issue. And if we don't learn from history and we have a split vote like we did before, we're going to repeat history and it will continue to be a partisan issue. The people can communicate can collaborate and communicate before another act is thrust upon us, and we can dictate the terms. A recent poll asked people what they thought of the Affordable Care Act, and 70% responded that it was favorable, 30% unfavorable. They were then asked about Obamacare. 30% indicated favorable, and 70% indicated unfavorable. Here's the problem, folks. Obamacare is the Affordable Care Act. Obamacare is a nickname for the Affordable Care Act passed during the Obama administration. I would estimate that 90% or more of people have never gone to the Congress website and viewed proposed legislation. I urge all interested parties in this healthcare dilemma to review introduced bills regarding healthcare when they're introduced before they're thrust upon us. If not, we're rolling the dice. I want to point out the very common sentiment that is expressed. People say, I want universal health care like there is in other countries. I want Medicare for all. I want a single payer system. Some of the terms I never hear are the Bismarck model or national health insurance model. So what I glean from this is the grass is greener on the other side of the fence mentality, okay? If we are going to have a substantial, quality, affordable healthcare system, and if we are going to tell Congress what the elements that we want in these plans, we have to do more than just look over the fence and say, I want what they have over there. We need to know what these are. And we need to be well versed in what we will be getting so that we're not stuck for another 16 years with a broken healthcare system. The nation can't wait again. It's been 16 years since a less than perfect system was introduced. There's an election coming up, and we need to elect officials who will work together so that we don't wait another 16 years or indefinitely suffering through a broken healthcare system. And again, this is not a partisan issue. The road you drive down to get to your house, you don't look at it and say Democrat or Republican. Healthcare should be the same. This is not a partisan issue. We should have healthcare that works for every citizen. To do that, we need to communicate to our congressional representatives, our senators and our representatives, House of Representatives, specifics of what we want. On American Healthcare is working to work with the people and develop a plan that can be submitted to Congress that has specific initiatives data and statistics, timelines, coverage, costs, how it's paid for, and we can participate in the legislative process. We don't need another tug of war where we are the rope. The next act for healthcare should not be split down the middle. It should be nearly unanimous, if not unanimous. Then we will all enjoy a world-leading healthcare system. Look, it's very complicated, and that is one reason that the can has been kicked down the road for so long. It is extremely complicated. There's many key issues in reforming the U.S. healthcare system. Access and coverage, cost, the system structure and complexity, quality and outcomes. Of course, that is likely should have been the first bullet. Prescription drug costs. We pay the highest cost for drugs on this planet. There's going to be workforce and infrastructure and even corporate concerns. And of course, in a two-party system, there's going to be political and ideological divide. But instead of calling names and pointing the fingers and blaming the other side, the only way for this to work is for us to collaborate and work together towards a system that truly works for everybody. So, we can let corporations fill the ballot box with money, with special interest money, or the people can speak, and the people can demand of leadership, of government, that our needs be met. Again, if you like this video, please join us for more content. Please like, share, comment, and subscribe to On American Healthcare, where the United must return to the states. We must be United States in healthcare. We must work together so that we can have a rehabilitated healthcare system.